Nancy LeBeau. I'm the founder and CEO of Alumni in Recovery. And I want to thank everybody for being here to this wonderful presentation, Heart at Work, that we like to do. It's so important because our law enforcement work really hard. Police everywhere within Bergen County have given so much time and effort, and especially in regards to all the Narcan deployments over the last decade. And it's just during the pandemic, as we all know, it got so much worse. And, you know, thank goodness they are so skilled and equipped to save so many lives with Narcan. But at the same time, being a nurse and having worked as an EMT, it's very hard on people to have to watch people in the throes of possible death. And our police have had to endure that and put a lot of emotions to the side to just help deal with the situations on hand and then go to the next one. And I can't thank them enough. This is very much an epidemic, and we owe them a ton of gratitude. So I thank our law enforcement, and I especially thank tonight's guests that we have. We have Chief John Russo from the Rutherford Police Department, as well as Sergeant Justin Krapels from the Closter Police Department. So I thank you both for being here to share what you do within your towns, and we look forward to hearing that. A little about Alumni in Recovery. For those that don't know, we speak locally. We are local people speaking in schools and to the community. We are the grieving community and the recovery community, speaking on a peer-to-peer approach. We believe our stories matter, and we believe your stories matter, and that there's the language of the heart through stories. When people share their experiences, it touches others. And what we know about addiction is it wants us to isolate, it wants us to disconnect. And during the pandemic especially, it was a terrible time it was hard for people to connect. And thank goodness for Zoom and virtual presentations, because that really made a big difference. But the thing is, it just exacerbated mental health conditions, as we know, and mental health, people self-medicate. I can speak for myself. I'm a woman. I've been in recovery for over 30 years. I got sober when I was 26. And what I know is that I was in complete denial. I was mostly alcohol. I was back generations ago. It seems like generations ago when pills weren't on the forefront, and it wasn't such a dangerous landscape. But I'm grateful to say that, I've abstained and stayed sober for about 33 years now. And that's what people in recovery from alcohol and drug addiction, like people like me, need to do, and that is to abstain and find a community to support us, right? So now we have all sorts of different levels of what's with the opioid epidemic, especially of people that are affected, and how can we connect everybody? So conversations like these are really important. We're about to go into summer. This is going to be our last presentation. Prosecutor Musella has been here for months now doing these presentations, and we're going to resume them once summer kind of sizzles down, okay? And the thing about summer, I think it's really important, is that we have this program that will be available afterwards on YouTube. You can show it to your communities, and it's also being shown right now on live Facebook. Hi everybody out there on Facebook that's joining us. I thank you. And the thing is that I can speak for myself, and I can speak for many of our members in Alumni in Recovery. This summertime is a very difficult time, and I think we all know that you could fall into substance misuse. And I think this is a very important time that we're talking about addiction, and we're having these conversations about mental health and the possibility of substance misuse, especially because I know for myself, when I got sober, the first thing that came to my mind was, I can't do that. How am I going to like not have a drink during the summer? You know, how am I going to do that? You know, and the problem is that when I drink, you know, all bets are off. You know, I'll get in a car and drive badly, or, you know, I could use a substance that I necessarily wouldn't have used because my thinking isn't clear at all. Okay. And that's the thing. You know, we have to be having these conversations, because even alcohol, we have to have a little bit more of a mindful attitude about that at times. You know, we have to have conversations openly and honestly, so we can begin to turn this disease process around. We can prevent, and, you know, knowledge is power. So I thank you for that. And, you know, like I said, we're available for junior police academies in the summer, and, you know, our members are great young people, and they have tremendously good stories. So that is what I have for me, because I would like to talk about our walk for just a minute. We have this great walk event, okay? All right, and here, just for example, are some of the officers that were there. I can't thank the Westwood Police Department enough, because it was in the town of Westwood. They did a remarkable job, just allowing us. They directed traffic. They just were there. Oh, they served pizza. You know, they served pizza to tons of people, because we have this pizza positivity program, and they were just there to help serve it. It's a cool program. I won't go into it right now. But what was really, really wonderful is Prosecutor Musella, who showed up. He had to leave a ski trip to come join us. And but he did. That's right, Utah, woohoo! But he did. And what I'm getting to is that he showed up, and he's been showing up for recovery. He's been showing up for these addiction awareness events on a regular basis. And here he is. He's photobombing right there and doing a selfie. And he was also speaking. And he did a wonderful tribute to our first responders. And I thank him for that. And I thank him for showing up today, as we do. And I'm going to turn it over to you now, Prosecutor. Thank you.
Thank you, Nancy. You know, Nancy, as I always say, you're an inspiration to me, and you're at all these events, and you know, you bring law enforcement together with the recovery community, and I think you're doing a great job. And I come out because you're here all the time, and all our partners are here. So I think it's very important work that you're doing, and I think it's very important that you recognize law enforcement's role in this as well. And when we work together, we can do great things. So I want to thank you for organizing tonight's event. I want to thank Morgan Kennedy as well for organizing tonight's event. I want to thank Alumni in Recovery for all that you do. It's a pleasure to be here tonight and to participate in this event. And again, I want to thank the men and women in Bergen County law enforcement for being innovators and role models, and for the compassionate public servants that they are, and for their response to this opioid crisis, along with our partners. I believe that we are saving lives together. Events like this are important, and like the event that we had in Westwood last month, I think they're all important because, again, Nancy, you have shown us that they raise awareness, they end stigma, and you know, they help save lives by connecting people to treatment. So these events are important, and as long as you hold them, I will be coming, and members of my office will also be coming to these events. So tonight, before, you know, I just want to talk a little bit about what we're doing here in Bergen County to save lives, both the Bergen County Prosecutor's Office and law enforcement in Bergen County. So I like to always kick it off by talking about the numbers. So last year, drug overdoses in the United States killed more people than car accidents, gun violence, and the flu combined. For the first time, the CDC announced that over 100,000 Americans or people in the United States died of a drug overdose. That was the first time that number eclipsed 100,000. There are 4 states, however, in the United States that did not see an increase in fatal overdoses, and New Jersey was one of them. We still have a lot of work to do, but we are making a difference. And again, I believe that's the result of the forward thinking of law enforcement in New Jersey and in Bergen County, and the forward thinking of our partners again, in New Jersey and in Bergen County. So I want to talk about three things that we're doing in Bergen County, both, again, the prosecutor's office and law enforcement. And the three things that I talk about every time at these events is prevention, connection, and diversion. Regarding prevention, members of my office are at the Bergen County, are at the George Washington Bridge every day. We're on the highways, Route 80, Route 17, and we're intercepting drugs and money that flow through Bergen County every day. Members of my office are also in the classrooms every Friday. We are in 7th and 9th grades teaching pathways to addiction to our young people. We've been doing this for the last 6 years. In this presentation, detectives from my office talk about the main pathways to addiction that we see that lead young people into an opioid or substance abuse problem. And it's usually after a sports injury or after a medical treatment or after some type of dental procedure. The other way is through experimentation with alcohol, marijuana, and pills. So we talk to the young people about the dangers of these things, and we hope to again stop them from becoming addicted or to abusing opioids. We also partner with the Bergen County Utilities Authority, and we have recycling events, and we have drop boxes where people can drop off their unused and expired opioids. We urge people to clean out their medical cabinets periodically, and we urge them that it is never all right to use expired medication. So that is something else that we've been doing in an effort to prevent opioid abuse. Second, I want to talk about is connection, and this is where the police officers in Bergen County, the 3,000 police officers in Bergen County, really come into play every day. Police officers in Bergen County connect individuals that are struggling with addiction to recovery every day. Since 2014, all police officers in Bergen County have carried Narcan. Last year alone, they deployed Narcan 368 times. That's almost every day. That's, in fact, once a day. We had 700 overdoses in Bergen County last year. I have the updated numbers from the medical examiner. 155 of them were fatal overdoses. For the past 4 years after Narcan deployment, as a result of the AG directive and Bergen County Prosecutor's Office directive, officers that deploy Narcan must call a peer recovery specialist to come to the hospital where the person is taking. And these phone calls are, again, one of the ways that Bergen County police officers are creating opportunities to connect people to treatment and recovery. Police officers also, after arresting anyone for a low-level drug offense, have the opportunity to connect a person with a peer recovery specialist and offer them treatment and a diversion from prosecution. Another way that we connect people is, of course, through Operation Helping Hand. We have been doing Operation Helping Hand for the past 6 years. Peer recovery specialists sit in our Paramus office and meet with those arrested and talk to them about treatment. And we found that this model has been the successful model where a peer recovery specialist and a patient navigator talks to an individual that has been arrested and has been more successful than our earlier operations where police officers spoke to these individuals. So in short, as you can see, we're using every interaction with police and with law enforcement as a connection opportunity. The third thing I want to talk to you about is diversion. Prior to the COVID pandemic, we started a diversion court in a pilot project in Fairlawn Municipal Court. We called it the Fairlawn Initiative. It was sort of like a municipal drug court. Again, we found that having peer recovery specialists and patient navigators at the court was a way where we could help the prosecutor, the public defender, and the judge could help steer people toward treatment. We also expanded the Fairlawn Initiative so that the police officers could offer treatment, again, as I mentioned, at time of arrest, and have them introduced to a peer recovery specialist or patient navigator at time of arrest. We wanted to have the person have the opportunity to be connected with treatment as early on in the process as possible. I had told you, and I had been mentioning to you at events like this, that we had hoped to take this model countywide. And in fact, at the Westwood Walk, the Black Project Walk last month, I did announce for the first time, and I'll repeat it tonight, that we have received approval from the AOC and from Judge Misdall and we have secured funding through the County of Bergen to open a countywide central municipal court, a recovery court, a municipal drug court, if you will, in Hackensack in September, so that all individuals that are suffering from substance abuse throughout the county will have their case, and that get arrested for a low-level drug offense can have their case referred to the Central Municipal Court in Hackensack, the recovery court, and they will be connected to a recovery specialist and patient navigator at that court. Tonight, I also want to take the opportunity, as I did in Westwood, to mention another way that we are connecting people to treatment is our 1-800 number. If you Google Stop the ODs, it will give you the 1-800 number. This is a 24-hour hotline. It is a phone manned by recovery specialists and patient navigators, so you will speak to a live person. And to date, over 500 people have made access and used and called that hotline. And I'm happy to report that 83% of the people that have called that hotline have been connected to treatment. So you can see that we're using every opportunity and every interaction with law enforcement as an opportunity to connect people to treatment. So in summing up, I just want to thank all our partners. I want to thank the County Office of Alcohol and Drug Dependency. I want to thank the Center for Alcohol and Drug Resources, Bergen Newbridge Medical Center, the Black Poster Project, Alumni in Recovery, and New Jersey Recovery Advocates, and all our partners for the great work that you do every day. And again, I want to thank the more than 3,000 police officers in Bergen County who sacrifice and serve every day in this fight against the opioid crisis. So thank you, and everyone have a happy and safe Memorial Day weekend. Thank you, Nancy.
Thank you, Prosecutor Musella. And it is so awesome to hear about the recovery court. I know that you've mentioned that before, but it's just good to be knowing about that, and going forward, as we go forward with this program, it'd be just good to continue to allow people to know it's going to be available. And I am so grateful for that. It's so important that we have, people that are experienced in addiction be able to help people in court and be able to refer them to treatment and
Yep.
to somebody that can help. So that's just such a breakthrough. Thank you. I want to welcome Sergeant Justin Krapels. I live close to Closter, New Jersey, and I have had the opportunity to bring Alumni in Recovery alongside before the pandemic. Lead at the time, I believe that Vinny Aiello he was detective at that time, was doing lead, if I'm not mistaken. And he had us come and bring a community event, one of which was one of the very first times the Black Poster Project was exhibited in Closter at their library when it was small. Not the library small, but the Black Poster Project at that time, there was about 50 posters. And it was a great opportunity to do a community event, and I really admire Chief McTeague and the rest of the police force. And so, anyways, I'm going to turn it over to you, Sergeant Justin Krapels. I can't wait to hear from you. Thank you.
Thank you very much, Nancy, for inviting us to be a part of this great event. Thank you also to all the other presenters here this evening. As always, the Closter Police Department appreciates everything you, Alumni in Recovery, the Black Poster Project, do for our communities. We'll always be here for you guys to support your efforts in our communities to bring awareness for the recovery process. For those of you who don't know me, I'm Sergeant Justin Krapels of the Closter Police Department. I've been with Closter for just under 10 years now as a police officer. I'm one of the juvenile officers as well. I grew up in the Northern Valley. I have a very strong connection to it. I 2006 graduate of Old Japan. I married a girl who went to Demarest, who graduated. So I'm very tied into the Valley. My family's been here forever. I coached football and wrestling at both Old Japan and Demarest high schools. And I've seen a lot of different things, obviously, since I went to school there and coached, and now being a police officer in the community. I know people who have been affected by the opioid crisis and other addictions, not just professionally, but personally. Many people I went to high school with have unfortunately passed away due to overdoses. Over the years, as a department, we realized that just locking someone up for someone who may have been involved in or possession of a controlled dangerous substance is not the end of our responsibilities anymore. We are so much more than that. And as the years have gone on, we've learned and adapted from that, especially because of programs like this. We're so much more than that. And the days of arresting, fingerprinting, photographing, just releasing them back out to their own devices is kind of over. It's our job to lend a helping hand, as well as find out how they got there and not just why you're there with us that night or that day. Is there anything that we can do for them that can help them? And finding out these things on a personal level might be the most important step in our process of getting to know that person also. We're here to help them along the way in their journey to recovery. We know it's not easy. We also know from what we've seen personally and professionally that former residents who have struggled with addiction and they're recovering as well, they've come back to help us. And, you know, we may have had to arrest them in the past, but we created that strong connection with them and we helped them get over that bad night that they had with us. And they've actually given us their phone numbers so we can reach out to them and then help, you know, future people that we've arrested to get in touch, and that we may not hear from them that night or that day or anything, but eventually they have been able to get help over the years. They also may not feel comfortable with us being that they were arrested that night, but at the end of the day, it's not so much just you being a bad person. You are sick, and we understand that now. And then again, thank you to great presentations like this on Black Post Project. It's more of an intimate connection now, and it's not just, you know, handcuffs on somebody and see you later. The important thing for the public to know, though, is that we're here for them. We are not here to write tickets and arrest people at all date times, but we are more than that now, and that we are here to help them no matter what the incidents got them inside of our headquarters. Like I said, we are much more than that, and we really hope we can relay that to everyone that's listening tonight. And again, thank you, Nancy, Black Post Project, not for only having us here tonight, but for all you do with overdose and awareness recovery and everything else that you provide for the great people of Bergen County.
Well, thank you, Sergeant Krapels. You know, I don't know if you were at the Closter event that we did with the Black Poster Project.
At Ruckman Field, yes.
Yes, you were there.
Yes.
That was a really well done Black Poster Project, and you know, and thank you for having us. That definitely was a good spot to be able to, you know, have people come in and see. So
we would love to have you back. Unfortunately, I personally knew too many faces on those posters. But you know, anything to help the community, and I love the Northern Valley. There's a reason why I stayed here. But I really hope we can have you guys back. And again, these programs are great for the community.
Yeah, thank you. And we just were also at Northern Valley Demarest High School just recently. We actually, Dee Gillen will be here later to just mention the Black Poster Project, but we're actually starting to go into schools and set the Black Poster Project up so the students can see it. Walk through, and then later on have it available for community events or school community events in the evening. So, you know,
we would love to be a part of that.
Yes, great. Thank you. And now you're welcome. Now we're going to go all the way down to the other side of Bergen County and introduce Chief John Russo. I just wanted to say, Chief Russo, I had the opportunity of meeting a couple of your officers a couple times over. There was one, and I would like to, I'm not going to get his name right. I want to call him Sam. That's just not right. But he was at the walk event, and he was very easy to talk to, and I was really grateful he was there. And then secondly, when we were at a church in East Rutherford, and I want to call it St. Joe's. I'm not quite sure if that's correct, but we were there, and we got to meet a couple of other officers that were there that evening and helped us do the community event. So you have a great community and a great police department, and thank you for joining us. I turn it over to you.
Thank you, Nancy. I appreciate the invitation. That was Stuart Madison at the walk event. He was my
thank you.
Yeah, he's terrific. Right out of the academy. but he's engaged. He gets it. So we're looking for big things from him. But thank you for the invitation. It's really an honor to be here tonight, to hear the stories and to discuss what we're doing in our communities. It's also an honor to sit with my fellow employees here, Sergeant Krapels, as well as my boss, Prosecutor Musella. The prosecutor, not only is he a friend of mine, he's a friend to everyone here in law enforcement. He's always at the forefront, regardless of what we're trying to do in law enforcement here to make this profession better, make our communities better. And you can see that with what he's doing with this initiative. So thank you, prosecutor. So here in Rutherford, we are definitely engaged with our community, department-wide. We get it. We know what's going on. We know how important this issue is. And we know, I believe, like the sergeant was referring to, we're not going to arrest our way out of this problem. That's not the answer. And that's the way policing was generations ago, decades ago. We learned from our mistakes. And I think what we're doing with the collaboration with our communities, our schools, our outreach on social media is going to be the way that we tackle this problem and hopefully beat it. When I say our department is invested here, it goes from the top down, right? I understand what's going on. I have a community outreach division that's headed by my Sergeant Julie Ziegler. You probably met her. She is engaged 1,000% with our schools, our community groups. We have a university, Felicia University Dead Center in our town. And this is always a topic, no matter what we're doing, whether it's National Night Out, an event at the school, at the university. Addiction recovery is always one of our objectives. So yeah, it's from the top down, not just the community outreach group. I have my patrol is well versed in this. So during the course of any day, we are going to have a full court press on this. And a lot of my department, they have husbands and wives that are nurses, right? Different field, but the same objectives. We truly see what's happening. Our officers are now trained in Narcan, like the prosecutor said, and as of just recently, we've had the Overdose Prevention Act, which was passed, where we are now supplying additional naloxone or Narcan units to those overdose patients that we may encounter that don't take transportation to the hospital. So we have already secured those units. That was a question for most agencies when this legislation passed, but we have been able to secure that pretty seamlessly. And from what I hear on a county and state level, it's been the same for most agencies. So this was an initiative, legislation that has been pretty seamless in its implementation. And unfortunately, we got to utilize that just last week with one of our deployments. So as law enforcement, we know that to overcome addiction, why it's so important for us, to spearhead this initiative, it lowers some of the collateral issues as well. Homelessness, domestic violence, crime, all that's associated in a way with addiction. So it's in our best interest as law enforcement officers to do our best to try and overcome this issue. We continue to do our drug take-back events with the DEA, and that's twice a year. And we will be looking, as we transition into a new building, we're going to be looking to have a permanent drug drop box as well. So, when we speak in our schools, even to the youngest students, we're educating them about prescription drugs and the dangers that are associated with those, and how they, tend to be a gateway drug as well. So, like I said, everything we're doing, even to the point of planning a new building, we're taking this into consideration. I like what you mentioned in your introduction about peer-to-peer. I think that is a terrific way to address this issue and combat this issue, especially in the younger age groups. And I know the prosecutor's office, we had initiatives in the past years where we brought people in, recovering addicts, to speak to our younger students in the schools, and that was always, and in my opinion, a successful initiative. So, we will continue to work on law enforcement's end. I know I will always be an advocate on the chief's level with the Chiefs Association here in Bergen County, and on the state level. We will continue to keep I have officers trained in lead. I have basically a 40-person department, and I have 7 officers that are lead instructors. So whether it's lead or dare, our officers will be in the schools, discussing this at a very early age. We also have agents that we will put officers on loan to the prosecutor's office to assist with initiatives that they have, as well as some of our federal agencies, to really attack this problem, the dealers at a very high level. So we're out there, and we'll continue to be out there. I just want to mention, I know we've mentioned law enforcement a lot tonight, but, I'd also like to thank all of our partners on the medical field, our ambulance corps members, and our responding medic units that come out of the hospitals during these incidents that we deal with, overdose incidents. Without them, our initiatives would not be as successful as they are. We're the first responders; they're right behind us, and they are the ones that really get these individuals to the care that they need. So that's it for me. I'm looking forward to hearing what else has to be said today.
Great, thank you so much. And you are absolutely right. Working as an EMT, and actually one of my favorite EMT people is actually in the audience tonight. Somebody I rode with in Old Japan, and the thing is that 70 towns. They're mostly volunteers. There's some paid service, but overall, people that are giving of themselves in service to be on ambulance corps, first aid corps all around our county, and yes, the compassion is like none other. And I was really grateful for those years, and thank you for bringing up our first aid.
Thank you. They are great people.
Yeah, they really are. So you were also bringing up just the peer-to-peer approach of just speaking in schools. And when I started Alumni in Recovery, I started it based on the fact that I knew that possibly even just alumni from the town that went through that school has the ability to reach others, reach the minds of our youth better than anybody. So we created this program, so we were able to do that, and we got our numbers. And from September 2021 to June 2022 school year, we did 40 in-school presentations, many of which were with law enforcement, with 3 or not even once in your lead programs. We speak alongside you, and we appreciate having that opportunity to do it. And we reached over 7,330 students, and when our motto is always like, if we save one life, if we change somebody's mind, just one in each classroom, that's enough. And but we know we've helped plant seeds in many minds, and we'll continue to do that. And that leads me to my association with Springhouse, which is under the Bergen County Health Department, Division of Addiction Services Department. And how I started Alumni in Recovery was because I was asked when I was the medical liaison working as a nurse over at Springhouse back in 2013 to bring women in, young women into some of the schools. The first one was Indian Hills. And I brought 2 young women with me, and I sat and I listened to them. And I'm in recovery. So, to see these young people speak in such a way that that the students could identify, and just watching the interaction and the students asking questions, and they were really listening. And I said, we got to do more of this. And it started with Springhouse. And Springhouse is an amazing facility. It's a treatment facility for women, run by women. Not one man works there, on the grounds of Bergen Newbridge. And it's been there for years. It's a free service for the women of Bergen County that need help with addiction. And Shelby Klein, who is the director of the Division of Mental Health and Addiction Services of Bergen County, can tell us about that and many other things. And I'm so happy that she's here with us tonight. So I'm going to turn it over to you, Shelby.
Thank you, Nancy. Thank you for inviting me to join tonight. I very much appreciate being part of this conversation, especially with people. The general public doesn't realize how closely mental health and addiction treatment providers work hand in hand with law enforcement, especially more and more so over recent years in different ways, not just working together, but also planning together, which is important. So let me first give you a little bit of information about our department, how we work with law enforcement, and some of the services that we provide and support in the community. So our division is under the Department of Health. It's the Mental Health and Addiction Services Division. We are a recently merged division. Mental health and addictions used to be separate, but they have merged them together in recognition of a lot of times there's a co-occurring component. A lot of times, even though there's some differences in the systems, a lot of times it benefits individuals to receive help from both areas of expertise, because a lot of times that's what's needed. So our division, our focus is to ensure that all Bergen County residents have access to treatment services. And we do that a variety of ways. We fund and we directly provide treatment services, but more importantly, we have a big emphasis on raising awareness in the community. And as I mentioned a little bit earlier, planning, cross-systems planning is an important component of our work, so we can see what is happening in different systems, what's happening in law enforcement, what's happening in schools, what's happening among treatment providers, the community, juvenile justice system, the homeless shelter, what's going on. And it's really, we come together for various meetings in the community, and, we really try to plan so that in Bergen County, we can use our resources most efficiently and effectively. And that's something I'm very proud of. In Bergen County, we do that really, really well. I've worked in other areas of the states, and, it's not quite the same experience sometimes. So, and as I mentioned before, and mentioned by Chief Russo, Sergeant Krapels, and Prosecutor Musella, as well as, we're all working towards helping people, right? And it's not just about stopping and finding someone that can need help, but really connecting them with the local resources and helping them. And some of the ways that we do that with law enforcement specifically is I participate in planning groups like the Juvenile Justice Commission. I attend juvenile officer meetings to share information. I participate in the Crisis Intervention Team, the CIT Steering Committee, where law enforcement and the mental health community come together and end addictions to learn and get perspective of each other's roles in the community. And we do support things like Operation Helping Hand in the community, as well as other trainings that are available. In relation to raising awareness, we often do that under our stigma-free umbrella in Bergen County. That's the branding. We offer things like mental health first aid training, which includes an addictions module in there. Suicide prevention training, such as Talk Saves Lives, hosting events in the community. Last year, one of our events was the Black Poster Project over at Vanstone Park. Last week, more recently, we announced the winners of a stigma-free sticker contest for middle and high school students in Bergen County. So we touch the community in as many creative ways, and often it's always in collaboration with different community partners, because that's how we reach the communities, with local partners. In terms of services, we fund municipal alliances in Bergen County. So it's local funding that goes to communities so that they can identify their more local specific needs and interests and have that funding to support them. We also fund some early intervention programs. Again, it's based on our community needs assessment. We have resources that we're able to share with providers to implement those types of services. On the treatment side, we do fund some programs, but the county does operate Spring House for Women, as Nancy mentioned. It is considered a halfway house, but it's a much more clinically grounded program than a traditional halfway house model available in Bergen County. And we also help fund the Ladder Project, which is not run by the county, but is the halfway house for men as well. And we also provide outpatient treatment services and intensive outpatient treatment services for adults in Bergen County, again, at no cost to residents. It's not a barrier. If you have insurance, we'll take it. But if you don't, it's not a barrier to treatment. We want to assist anyone that we can. And there's other programs that we fund around the community as well. One of our more recent initiatives, which we do in collaboration with the prosecutor's office, is operate the overdose fatality review team for Bergen County. And during those meetings, stakeholders involved with a particular case, a particular person that has passed, they come together to really review the history of that person and where they touched the system and when. And it's an opportunity to really look at cases and identify how and where improvements could be made. You know, what are the trends that are being seen so that new and different types of interventions can be implemented in the community as well. So we are very, happy to work with law enforcement, as I mentioned, through various trainings, or to work with them in their communities on different awareness events as well. And I really appreciate the opportunity to give you a little overview of what we do here tonight.
Thanks, Shelby. That was great. Appreciate that. And yes, somebody was just talking last night about the mental health training. They said that was excellent and that everybody should, go through it and be trained in it. So it's really a great thing that you offer, and it goes so hand in hand. Like you said, this is such a co-occurring disorder. Addiction. Again, when you're in mental health crises, you turn to substances. You can activate an addictive process, just a physical addictive process, and become dependent. So there's so many variations, and it really does go hand in hand. So, I'm very happy to hear that there's more of a fusion between the two within the county. So thank you very much. And I was just talking with Shelby before we started the program, and we were talking about how she, saw the Black Poster Project in her town in Park Ridge, because it was set up at Our Lady of Mercy church there. And it's quite beautiful in the church, like it was when we had it at Rutherford. And when we also had it at St. Mary's in Closter, by the way. So we've been in Closter 3 times with the Black Poster Project. But, no, the Demarest for the high school. So that would be 4. But the Black Poster Project is something that with alumni in recovery, we can create these incredible community events with the help of people within the towns, with our local police and with the alliances and with the county and with our resources that we have, that we can create these events where people can come together. And Dee Gillen is just, she's here, and I would just like her to maybe say just a couple of words about the Black Poster Project, because she works incredibly. She's probably not going to be happy I'm saying it, but she works so hard at this. She puts these posters together. She does it all on her own, and it's no cost to any of the people that put their loved ones in the Black Poster Project. So anybody out there that doesn't know about it, I just wanted her to give a little overview. Dee, thanks for joining us.
Okay. Nancy, I just want to mention Lyndhurst and St. Michael's too.
Oh, Lyndhurst and St. Michael's was wonderful. Absolutely. That was an incredible event. In fact, I don't know if we have any pictures of that right now, but that actually was one of the best community events we had in quite some time.
Hi, everybody. I'm so glad to be here. Thank you so much for having me. I always feel like it's an honor to be part of what Alumni in Recovery does and what all of you are doing as well. Because I feel like it just completes the circle of including us, the grieving families. And I'm actually with my husband right now trying to figure out if Justin played football in high school, because I think you played against my son, Scott, who is in my project. That's why I have my project. Yeah. So I believe you played football against him.
I did.
Yes.
And I knew Scott. So that's why the Black Poster Project also kind of ties in a little bit. So, yeah,
well, thank you for that. Anyways, I always say, it is such an honor to be part of this movement, because I guess, when Scott was alive and it was a different story, my motives were different. But when he died, I didn't know what I was going to do. And I knew I wanted to do something to make a difference, but didn't know what until I ran into Nancy. And then, everything changed. So I think, together, our 2 groups, our 2 organizations, we're doing some pretty great awareness work. I have one more display in Astoria, Queens on June 12th, if anybody is in that area. But that's what we're doing until the fall, where we're going to start doing, I guess, schools and communities again. But it is really, is an honor to work with all of you. It's such important work. And, it represents the grieving side of this whole situation, which is, it tells a story. It tells a story to people about staying on their programs, and, whether it's somebody in recovery or families that are trying to figure out what this is all about, we tell a story. And it's an important facet of it. And I'm proud to be able to be part of what you all are doing. Thank you very much for including us.
Thanks. Thank you, Dee. And yes, thank you all very much for including us. Exactly. Because we really, truly believe that we can get the public involved. There's a saying in Alcoholics Anonymous, and that is, I drink, we stay sober. This is a we program. And I really, truly believe that just through things like this, that we have these conversations and we talk about it often. We do, and we're doing it. And I hope that you get something out of tonight's this presentation. It's, like I said, it will be saved on our Alumni in Recovery YouTube channel and available. And and show it within the schools, show it to people, like groups and organizations. I mean, it sparks conversations, and that's exactly what we need when it comes to addiction, because it keeps us in the light. you know, instead of falling down into the darkness of it. I think that it's really important that we had this conversation tonight. Thank you. We're about to go into Memorial Day weekend. So this was really helpful because, you know, we need to kind of create a safety net this summer, a supportive safety net for our communities as we go into the summer months, you know, which are glorious. So that's, I want to thank everybody again. We'll start this back up, like I said, after summer kind of comes to a close. Again, thank you for everybody that spoke tonight. And we're going to end it with a short video from the walk. And, you know, so if you want to just watch it, it's like a minute long. It's even less. It was from, I think it was from Channel 12 News, right, Morgan? Yep, there she is. All right, thanks, everybody. Great. Okay. Good night. Thank you. Thanks, everybody.
Naomi, thanks for staying on top of those. Well, deaths from drug overdoses are at a record high in this country. One Bergen County community gathering today and using a visual reminder of the toll it's taken. News 12's Eileen LaPalmer was at Addiction Awareness Walk in Westwood.
It just keeps their memories alive.
Each poster is a face, a name, a loved one lost to a drug addiction.
We want them to be remembered for the lives that they should have been living.
438 posters line the fences here at Westvale Park, the Black Poster Project, part of the Addiction Awareness Walk in Westwood. And in addition to the Black Poster Project, there are other reminders of the lives lost, like this dining room table set with one empty chair. And there's also these shoes placed on a hillside right here by the playground with names like my student, my grandma, my teacher.
It is more prevalent than people want to recognize or care to recognize. It could be the clerk behind the supermarket counter. It could be the vice president of a company.
Sherry Williams Rutz is volunteering at the event. Her 32-year-old son, Jonathan, died by suicide in June 2020, days after relapsing following a year of recovery.
Very unforeseen for someone who's a very successful Army vet and a good-hearted soul.
Sherry says the awareness walk is about hope and preventing others from falling victim to addiction by letting them know they are not alone.
The support is there for them, and that the shame needs to be removed from their minds.
National statistics show that fatal drug overdoses have increased since the pandemic shutdowns began in 2020.
We have just come out of the COVID pandemic, and this is a great day for us to be able to get together, collaborate, and find ways and solutions together around addiction awareness, mental health issues.
We met Becky in tears during the walk.
I'm in recovery, so it's just sad. It makes me sad that these people didn't find the solution.
Dee Gillian, who founded the Black Poster Project after her son Scott overdosed, says there is hope, and events like this are key to a better tomorrow.
And it's a really important connection to have the people in recovery be with the people that lost their battle, because it keeps them humble and on their program and, you know, intact with what they need to do to not be a poster.
In Westwood, Eileen LaPalmer, News 12, New Jersey.
The organizer of the event and the walk hopes to raise $20,000 to pay for drug education programs in local schools.
Again, everybody, have a good night and a safe summer.
Night, everybody. Thank you.
Thank you. Good night. Good night all.
Good night.
Thank you. Good night.